actually kanina pa sa big story, inumpisa na natin yung kwentuhan tungkol sa ditong this co-payment scheme. And at bottom, what Dr. Almora and the Philippine Health Association was say, Hospital Association was saying yesterday pa is, sabi niya nga, we're caught between, it's a real dilemma. On the one hand, syempre ayaw naman naming magpaalis ng mga tao. We want to accept people as they come. On the other hand, he's saying, pagka naman tinanggap namin, ipit kami dito when it comes to the co-payment scheme kasi we're restricted basically, if I understand it correctly, we're restricted on what we can finance and also what we can co-finance and what we can collect from the patients. And now we know there are conversations with PhilHealth already between the PHA and PhilHealth, but let's start with the basic para maintindihan po natin. Ano po ba ang pwedeng i-cover ng PhilHealth when it comes to COVID cases, whether from mild all the way to severe cases?
Well, meron po tayong existing na COVID-19 packages. So ito po ay kapag kinailangan na ng pasyente na sila ay ma-hospitalize, no, for full treatment. So for those who are experiencing mild pneumonia, especially in the elderly or with comorbidities, ang ating pakete po dyan ay 43,997. Now, sabi ko nga kanina din sa interview with you, Roby, so depende yan doon sa severity, no, nung pneumonia ng pasyente. So starting with mild pneumonia, that's 43,997. Kung moderate pneumonia naman ay 143,267. Now, if the patient has severe pneumonia, ang package natin dyan ay 333,519. And for those with critical pneumonia naman, ay hanggang 786,384. So, tama po kayo dyan, no? And we appreciate the concern of the Philippine Hospital Association for bringing this up yesterday during our dialogue with them. And Atigiran committed naman that PhilHealth will seriously into their concerns patungkol po sa bagay na ito.
Yun po yung co-payment, yun yung binanggit sa amin ni Mr. Almora. I know you have a circular nung December pa, di ba? About the co-payment. So hindi naman siya kasabay actually ng surge. Pero yun ang gusto nilang mawala ngayon kasi yung mga member daw nila, lalo yung maliliit, hindi daw tinatanggap ngayon yung ibang mga pasyente dahil nga dyan sa prohibition na yan. Is PhilHealth willing to change this policy? Circular yun ng PhilHealth eh.
Well, tama po kayo, Ma'am Ana. Pero kung susuyuin po natin yung issue po talaga ng co-payment as a privilege to PhilHealth members, galing po talaga yan sa Universal Healthcare Law. Ang sabi po sa Universal Healthcare Law ay talagang dapat kung ang pasyente ay malalagay, no, mako-confine sa basic or ward accommodation, dapat po wala talaga silang babayaran. At ang provision ng UHC dyan ay kahit nasa private facility pa po, no. So, yan naman po ay mandato, provision po ng UHC law. At tayo naman sa PhilHealth ay pinapatupad lang po natin yan. Now, kung issue ng co-payment insofar as COVID-19 packages are concerned, nanggaling pa yan early part ng 2020 nung inintroduce po natin yung ating policy over these packages.
Ang sabi po kasi Dr. Almora, ang claim niya, mababa raw yung packages. So kung mababa raw yung packages at lumabis doon sa numbers na ito, yung gastusin, babagsak sa ospital yung sasagot nung balanse. Yun ang claim nila. I'm not saying that it's correct.
Yes.
I'm just saying that's what their claim is. Kaya raw nangingimi yung ibang ospital na tumanggap ng COVID patients. That is their claim.
Well, alam nyo po, when we ang naging basis po ng costing ng ating packages ay galing din sa actual costing data na ginather natin from hospitals that are treating COVID-19 patients. And so we can very well say na talagang yung packages are kumbaga reflective, no, or sapat na siya, akma siya para doon sa complete management ng pneumonia ng pasyente ng COVID. So masasabi po natin na talagang tumutugon ito, no, sa pangangailangan. Ang atin pong pinag-usapan dito is that for all direct healthcare costs, so these were all properly costed and accounted for last year. And so we were able to come out with these packages. Ngayon, ibang usapan po, kung halimbawa the patient availed of amenities, no, like he or she elected to stay in a suite, no,
Yes,
or
yes.
gusto nila aircon o may walang kasama sa kwarto, may wifi,
Definitely.
and it's a different story.
Definitely, yes. Okay.
Yes.
Opo.
Doc,
The
ay,
patient
sir.
has to understand na talagang meron na silang babayaran. Opo. Yes, ma'am.
Sir, you just announced na na-liquidate nyo na yung 14.7 billion ng 15 billion na hindi mapanagot ng PhilHealth nitong nakaraang taon. Pakipaliwanan nyo nga po kung paano nyo na-liquidate yun? Saan nyo nakita yung gastos? Saan?
Well, Ma'am Lucy, yun po yung patuloy nating gusto na i-address at linawin sa mga kababayan natin. That the 15 billion was not stolen, it was not lost, hindi po yan missing. Yan po ay properly accounted for. That 14.97 billion, to be exact po, last year, were provided to hospitals and facilities around the country that applied for it. At pinamahagi po sa kanila. At naglathala tayo ng listahan ng mga hospital, sino-sino sila, magkano yung nabigay po sa kanilang IRM, And over the course of this months, they were able to liquidate it. It's the hospitals that are liquidating it in the form of claims. In fact,
So wala
meron
na
nga
kayong
pong mga
utang?
hospitals na
Wala na kayong pinagkakautangang ospital na nag-file ng for IRM? Wala na? Bayad na lahat yun? Ganun po ba yun?
Well, insofar as the 15 billion is concerned, the hospitals are accounting it with us by way of liquidation. So, may mga hospitals na tapos na silang mag-liquidate because they were able to, kumbaga, file na the claims, na chinarge po nila doon sa kanilang IRM.
Yes.
May mga hospitals na counting-counting na lang na kino-complete na, kasi sabi nga natin, hindi rin lahat ng hospitals ay nagamit agad-agad po yung IRM because of the decrease in patient admissions, patient census. And there are some hospitals too that returned part of their IRM dahil talagang hindi naman nila maliliquidate na. Ibig sabihin, hindi na nila magagastos. So these are all properly accounted for. At the moment, it's 98% po, 14.7 billion. So we are down to the last 200 million at nag-issue na po ng direktiba si Attorney Giran sa mga hospitals na madaliin po yung liquidation.
In the
So
meantime,
tuloy po pa ulit yun? Kasi pinang-halt yun, di ba? Hindi mo ba pinatigil nyo yun? So tuloy po ba na ngayon yun?
Hindi po.
IRM?
Until now, hindi na po siya itinuloy since the time that it was suspended middle of last year.